2026 Individual and Family Plan Review. Hello, I am Kevin Knaus, an independent health insurance agent in California and a certified Covered California agent. And Covered California sets the standard benefit design plans for the individual and family market. Some of the carriers offer some non-standard benefit design plans, but I'm going to be focusing on the standard benefit design plans that are offered through Covered California and also off exchange direct with the carrier. The first plan is what they call the minimum coverage plan. This is available to individuals who are 30 years old and younger, and there is no subsidy attached with this. So if you enroll into the plan through Covered California, you can't get a subsidy. Preventive office visits are zero. The primary care visits, you get 3 at zero cost, but everything else is subject to the maximum out of pocket. So you're going to be paying the full negotiated rate for those healthcare services and prescription medications until you reach an out of pocket maximum of $10,600 for an individual. The next plan is the Bronze High Deductible Health Plan. And these plans are health savings account compliant, which means you can open up a health savings account and the money you contribute into that savings account can be, up to certain limits, can be deducted from your taxes. And then from this health savings account, this is the way the theory works, is that you pay for those healthcare services out of the account. And of course, you can also pay for dental and vision. But the high deductible plan, preventive, is going to be zero, but nothing is covered beyond that until you have accrued $7,200 as an individual in the deductible, which also happens to be the maximum out of pocket. So again, kind of like the minimum coverage, you pay the full contracted rate for all the healthcare services and the prescription medications until you hit the deductible maximum out of pocket. And the maximum out of pocket of $7,200 isn't too bad. Now, if you're going through Covered California and you are offered an enhanced silver plan, which are only offered through Covered California based on your income, it's hard not to enroll in one of those, especially if it's a silver 94 or a silver 87. That means you're getting a large subsidy and you're paying very little for your health insurance. And sometimes the premiums may be zero depending on the plan you select. So there's 3 levels: the silver 73, 87, and 94. Silver 94 being the highest actuarial value plan and the lowest cost sharing for those individuals in it. So you can see primary care office visits with a 73 is $50, then it drops down to $15 with the 87 and $5 for the 94. And emergency room visit $400 with the silver 73, $200 with the silver 87, and $50 with the silver 94. And the generic drugs are very low for the silver 87 and silver 94. There is a medical deductible on the silver 73 and silver 87, $5,200 for the 73 and $1,400 for the silver 87, and no deductible on the silver 94. But that deductible only comes into play if you're hospitalized. Okay. Outpatient services, if you have to have a surgery, that's going to be subject to just co-insurance, not the deductible. The silver 73 and 87 do have a pharmacy deductible of $50 for an individual before you go into those set co-payment amounts. And then the annual out-of-pocket maximum, which I refer to as the MOOP, maximum out-of-pocket. Silver 73 has an $8,100 max out of pocket. The Silver 87 is $3,350, and the Silver 94 is $1,400. So good, they're good. You'll have to look at the different premiums that are being offered to you in the different plans, but of course any healthcare plan you are going to be seriously considering will have your doctors involved in it. Then there are the standard bronze, silver, gold, and platinum plans. Bronze 60, silver 70, gold 80, platinum 90. Those numbers, those actuarial numbers, that means that the health plan has determined that, for instance, in a silver 70, the average person in the plan in a specific region will have 70% of their health care costs covered by the plan. So obviously if you go up in that actuarial value to like 90, you'd have 90% of your costs covered. With the bronze isn't too bad. $60 for primary care visits, no limit on that. Urgent care, $60. No limit on that. The specialist, you only get 3 visits at $95, and then you go into the full contracted negotiated rate, and lab tests are $50, not subject to the deductible, and the generic drugs are $20, not subject to any medical or pharmacy deductible. Emergency room, 40% after the deductible is met on the bronze plan, and that medical deductible on the bronze plan is $5,800. So you'd have to accrue $5,800 in healthcare expenses. Then you go into 40% if you are admitted to the emergency room, also for x-rays, imaging. If you're hospitalized, after you meet that deductible, you go into 40%. There is a pharmacy deductible of $450. The maximum out of pocket on the bronze plan is $9,800. Now, the silver plan, that's real good, definitely for people who take prescription medications, especially brand name medications, because that can save a lot. But a lot of the routine healthcare services just have a set copayment, not subject to the medical deductible, no limits, so you can see a specialist as often as you like at $90. Lab tests are $50, x-rays $95, imaging $325, multiple times. There's no limit on that, not subject to a deductible. The silver plan does have a medical deductible of $5,200, and again, that only applies if you're hospitalized or in a skilled nursing facility. Otherwise, like if you have an outpatient surgery, it's going to be 30% co-insurance. The maximum out of pocket for an individual on the silver plan is $9,800, just like that bronze plan. So overall, the silver isn't too bad because it has so many routine healthcare services with just a set copayment. The gold plan, no medical or pharmacy deductible. You're either in a set copayment or co-insurance of 25%. Some of the stuff is 25%, some of it's 30%, some of it's 20%, but that helps lower the overall cost. So primary care visits $50, a little bit less expensive than the silver plan. Urgent care $40, a little bit less. So as you go down the list, you can see the gold plan has slightly lower co-payments for many routine healthcare services. The drug prices are a little bit lower. And the maximum out of pocket is $9,200. So, $600 less than the silver plan. So, the gold plans, they do have their place, but for the extra premium, they don't always work. Platinum plan, 90% coverage. Primary care visits, $15. Urgent care, $15. So you can see all those routine healthcare services, no medical deductible, are much lower than the silver or the gold. Very close to the silver 94. Where people can really save money on the platinum plan for certain health conditions, chronic conditions, imaging, 10% or a $30 copay, and most of the services that don't have a set copayment with them will be subject to a 10% co-insurance, which is pretty good. But the drug prices are much lower, especially if you're taking brand name drugs. That's where you can save a lot of money. No medical deductible or pharmacy deductible, and a maximum out of pocket of $5,000. Again, you have to kind of compare premiums to see how it all falls, but definitely, if you're offered an enhanced silver plan, you'd want to go with that over a gold or a platinum for the most instances. But if you aren't, then, the platinum can be good in certain situations. But not everyone needs to go to the doctor on a regular basis. Maybe you have a couple different things going on or nothing at all. And so what I have done is I have plotted the maximum out of pocket based on a scenario of the worst case scenario where, the premiums, and when you add those together, what does it all look like? So if we think of health insurance as buying a maximum liability for health care and prescription drug services, how much is it costing us? You don't anticipate going to the doctor or taking any drugs. This is for the big boom, you're in an accident or something happens and you have to go through surgery, and you're immediately going to hit your maximum out of pocket with any of the plans. So the maximum out of pocket amount is set. That's not going to change during the year. We know that. The premiums, they're all over the place. So what I have done, and I've taken the annual premiums for a 40-year-old in Santa Clara County, which is Region 7, and I selected the least cost plan offered in each metal tier. So looking at it on an annual basis. So for the bronze high deductible health plan with a $7,200 maximum out of pocket, this 40-year-old, the annual premiums would be $5,895. For the bronze 60, it's $6,243. You still see a big gap. It's much less than the maximum out of pocket. Silver plan, a little bit higher, so we're getting a little bit smaller there. And then the gold, $7,627. And then the platinum plan, $9,032 annually for this least expensive platinum plan. But you can see that the maximum out of pocket really drops down to $5,000. Now, from what I've been able to determine, this curve on the premiums is going to be fairly similar for all the carriers. Now for you, if you're an older individual, that premium curve may be above the maximum out of pocket amount. Okay, so it might be that for a silver plan, you're paying $10,000 without any subsidy. And of course, the maximum benefit, your maximum liability is $9,800. But what does it look like when we add those two together? Because that's kind of your total cost. On the bronze plan, $7,200 plus $5,895 is $13,095. That is the least expensive health insurance for this 40-year-old in Santa Clara County, the least expensive bronze high deductible health plan. And then what is kind of surprising is that platinum is the second lowest total out-of-pocket cost plan, because the maximum out of pocket, your maximum liability is so low at $5,000, even though the premiums at $9,032 are almost twice that of the bronze high deductible health plan. Now, we don't know if that big event's going to happen. However, some people do know because they already have the surgery planned. And that's when some people will choose that bronze plan or the high deductible health plan because they know they're going to have that surgery early in January and February. boom, hit the maximum out of pocket, but you have to continue to make your premium payments. So that's why it's all totaled together. So some people may want to consider looking at the Platinum plan depending on the situation and their, the health plan that they want and the doctors. That might be a good deal. The Bronze plan comes in third, Gold is fourth, and then total maximum out of pocket plus premiums is going to be the Silver plan. So if you have any questions or comments, you may leave those down below and I will do my best to answer them. Otherwise, for InsureMeKevin.com, I'm Kevin Canals.